Phenylketonuria, or PKU. Introduction. If not treated, phenylketonuria can cause mental disabilities. Select true or false.
Correct.
A PKU carrier will not have symptoms of PKU. Select true or false. Correct. A PKU carrier will not have symptoms of PKU. Even though there is one defective little p gene, the good big P gene is strong enough to process all the phenylalanine in the blood.
A child ends up with PKU when both parents have a defective lowercase p gene and both pass it on to their baby.
Select true or false.
Correct. When both parents are PKU carriers or uppercase lowercase p, what is the chance that their baby will have PKU?
Choose one of the following options. 1.
No chance at all.
2.
1 in 4 or 25%.
3.
2 in 4 or 50%.
4.
The baby will definitely have PKU. Correct. The chance is 1 in 4 or 25%. The PKU test is accurate if it is done when the baby is more than 24 hours old.
Select true or false. Correct. Since the PKU test may not be accurate if done before the baby is 24 hours old, another test may be recommended. Healthcare providers usually recommend that the baby be tested again when he or she is 1 to 2 weeks old.
People with PKU need regular blood tests to measure the levels of phenylalanine.
Select true or false.
Correct. Babies of mothers with untreated PKU have brain damage.
Select true or false.
Correct.
Thank you for using Explain.